A breast biopsy is usually performed to determine if a suspicious area or lump in your breast is cancerous. In this procedure, a sample of the suspicious tissue is removed so it can be examined in a laboratory. Breast biopsies involve one of 4 techniques: needle biopsy, which is generally done as an office procedure; stereotactic core biopsy, which is done under mammogram guidance; ultrasound-guided core biopsy; and surgical biopsy performed in the operating room. If your physician can feel your lump, he or she will often perform a needle biopsy, which may take the form of assist aspiration, fine needle aspiration biopsy, or core biopsy. In each procedure, a needle will be inserted into your breast to remove fluid or to sample the tissue. If your breast lump cannot be felt and is seen only on a mammogram or ultrasound, your physician may recommend a stereotactic core or ultrasound-guided core biopsy. For a stereotactic core biopsy, you will lie face down on a table with your breast visible through a hole in the table. Guided by a computer-generated mammogram of the suspicious area, your physician will insert a hollow needle into the breast mass and remove several small cylinders of tissue for examination. Ultrasound-guided core biopsies can be performed when your breast mass is detected on ultrasound. In this procedure, your physician will use an ultrasound probe to locate the mass and insert a hollow needle to remove several cores of tissue. Stereotactic and ultrasound-guided core biopsies involve removing a small sample of tissue with a needle. However, if a suspicious area detected by mammogram or ultrasound is not accessible by a core biopsy, or if your physician wants the entire area removed, he or she may recommend a surgical biopsy. Breast surgery is done in an operating room using 2 techniques: needle localization and excisional biopsy. For needle localization, a needle and wire will be inserted into the breast under mammogram or ultrasound guidance in order to mark the location of the suspicious area. Your surgeon will then make an incision in the breast at the site of the wire and remove the targeted area. Even if your breast lump can be felt, your physician may recommend removing the entire lump rather than sampling it with a needle. Once again, your surgeon will make an incision in the breast and remove the entire mass. Surgeons will often also remove a small amount of healthy tissue surrounding the mass during these procedures. Surgical biopsies can be done under local or general anesthesia. The type of anesthesia should be discussed with your surgeon. Since breast biopsies are done as an outpatient, you will be able to go home shortly after the procedure.